So the CDC guidelines have changed again. It's no secret that local hospitals and emergency rooms are overwhelmed right now. They are dealing with higher volume, higher acuity of patients, while also trying to work with a lot less staff. And this is not new news. We have been in this situation for some time now. But now, because of this Omicron variant, which is highly transmissible, the guidelines for returning to work for healthcare personnel who test positive for COVID has been revised. And this was actually an article that was posted on December 23rd by the CDC, so it's just like a little special holiday treat from them. And the article was titled, Strategies to Mitigate Healthcare Personnel Staffing Shortages. And I'll actually post the link in the description, so if you want to go ahead and read it for yourself, but I will discuss it in depth here as well. The article, it starts with a very thoughtful message, and I think they packaged it really pretty, so I'll go ahead and I'm going to read that for you verbatim, and then we'll kind of dissect and read between the lines. So it says, due to concerns about increased transmissibility of the SARS-CoV-2 Omicron variant, this guidance is being updated to enhance protection for healthcare personnel. Okay, so they're trying to protect us, that's nice. And visitors, and to address concerns about potential impacts on the healthcare system given a surge of SARS-CoV-2 infections. These updates will be refined as additional information becomes available to inform recommended actions. And we definitely look forward to hearing more of their evidence-based recommendations. So the part where it says that the revisions that were made were put in place to help protect healthcare professionals is laughable, in my opinion. I would have to say I think that is a giant lie. I mean, let's just call it what it is or what it is not. And it is definitely not put in place to protect healthcare personnel. I'm not saying that there's not a place for these crisis plans and that we are not in a crisis situation, but let's not sugarcoat it. It is definitely not to protect the healthcare personnel. So as you scroll down the article, the CDC provides a chart, and it's pretty easy to follow, but it definitely leaves some room for interpretation. And so I'm going to post it here and we can kind of go over it together. But in general, it's giving guidelines for return to work restrictions. And there's a conventional, and then there is a contingency, and then there is a crisis mode. And so we'll go over how the restrictions change based on what mode, I suppose, we are in at that time of healthcare. So the question is, in crisis mode, are there any restrictions for healthcare personnel who are sick returning to work? Or are healthcare personnel superhuman species that require absolutely no time for recovery from a virus that's literally killing hundreds of thousands of people? Let's see what the CDC has to say.
So the first row here is in regards to work restrictions for healthcare personnel who are positive for COVID. There are 3 columns: conventional, contingency, and then crisis. Conventional restrictions for return to work. This is the normal 10-day quarantine or a 7-day quarantine with a negative test. Then there are the columns for contingency and crisis. So contingency says the boosted, vaccinated, or unvaccinated can return to work after 5 days of quarantine with or without a negative test, who are asymptomatic or mildly symptomatic, but with improving symptoms. And then there's the crisis column, which says that boosted, vaccinated, or unvaccinated healthcare personnel have no return to work restrictions with quote-unquote prioritization considerations. So further on in this article, the CDC does elaborate on whatever this prioritization considerations is, but it leaves a lot of room for interpretation. Basically, the CDC says that there's a lot of things to consider when determining which COVID positive healthcare personnel can return to work, and these include things like this, and I'll share directly from the website. It says the type of healthcare personnel shortages that need to be addressed, where individual healthcare personnel are in their course of illness, the type of symptoms that they are experiencing, for example, a persistent fever, cough, their degree of interaction with patients and other healthcare personnel in the facility, and then the type of patients that they care for. For example, and this is where it says, consider patient care only with patients known or suspected to have SARS-CoV-2 infection rather than those immunocompromised patients.
So I'm a practical person, and I realize that supply needs to meet demand. And simply put, that's not happening anymore. We do not have the supply of healthcare professionals, specifically nurses, to meet the demand of the healthcare needs in this current state that we are in. So because of this, the CDC now has revised these guidelines to try and combat this supply and demand deficit. And so when I read through this chart, there were two things that really stood out to me that I wanted to be defined. And that is what is considered mildly symptomatic, and then what is considered a crisis situation. So obviously, because mildly symptomatic, well, these are the patients that the CDC is clearing to go back to work. So I want to define who are these patients and what are their symptoms. And then when is it considered a crisis situation? Because based on that chart, there are virtually no restrictions for personnel to return to work. So I want to know, when is it determined and when is it considered a crisis situation? You really, I feel like, kind of have to go digging for these answers, but I think that they need to be answered and clarified so there's a better understanding. And I did want to point out too that as you continue to read the article, after the chart that's provided, you'll see that they actually tend to lump mild to moderate symptoms together. It refers oftentimes to mild to moderately symptomatic COVID-infected healthcare personnel. So for completeness, I will share with you what the CDC defines mildly symptomatic and then what the CDC defines as moderately symptomatic. And that's what I mean too, is I feel like there is a lot of room left for interpretation here. And so I think because it's the CDC, I mean, hospital administrators, they can really lean on what the CDC recommends. And if it's left with so much interpretation, I'm worried that healthcare personnel can be even further exploited. Like I said, again, I'm practical. I get that we have to fill a need here, but at what cost, and who are we jeopardizing? What are we sacrificing? So, and this is directly from the CDC. It says mild illness is those individuals with fever, cough, sore throat, malaise, headache, and myalgias without shortness of breath or abnormal imaging, okay? We've all gone to work sick, and I get that. The concern, of course, is that it's not that black and white. We know not everybody responds the same to the virus. Some are asymptomatic, some are mildly symptomatic, and some end up on a ventilator and die. And then so in moderate illness, this is defined as individuals who have lower respiratory disease as evidenced by clinical presentation or abnormal imaging with an SpO2 of 94% or greater. So those are the definitions provided by the CDC. Again, I think there's a lot of room for interpretation, and it worries me that this could get into the hands of hospital administrators and they could use this as well, the CDC says you're fine to go back to work. And it's really not fair. When we've told nurses and healthcare in the beginning, everyone got to stay home, and we said, you know what, you got to show up. You got to work. You got to show up for your calling, for your duty. And now we're saying, even if you get sick, you don't get to stay home and rest. It's just when do healthcare personnel get to recover, and when do healthcare personnel get to be at all prioritized in their mental health, their physical health, their emotional health? I mean, these are humans too, and they really need to have somebody advocating for them. It's concerning. It's concerning for the future of our healthcare. Nurses are the backbone of healthcare. If we lose our nurses, we are screwed. So another definition, like I said, that I wanted was what is considered this crisis situation. And I feel like I had to dig a little bit harder for this to see exactly how the CDC defines a crisis and when we implement these like crisis restrictions or guidelines to return to work. But I did find something, and so I'll read it for you here. So the CDC defines crisis standards of care as being indicated if the current standard of care reflects a substantial change in the usual healthcare operations and the level of care that healthcare personnel are capable of delivering during said crisis. So this, to me, I don't know about where you're at, but I'm pretty positive that this applies to all of my local hospitals currently. And like I said, yeah, I agree. We are in crisis. We've been in crisis for quite some time now, and we have not gotten the help that we've needed, and we've slowly dwindled away our support staff, our healthcares, they're leaving the job, and it's easy to see why. I don't mean to sound dramatic, I really don't, but I mean, if you're listening to everything that I'm saying, you can see that the incentive to stay in healthcare and in nursing right now, it's really plummeting. And so I'm concerned, and I can understand why the nursing burnout is continuing to escalate. And I'm just worried about the future of healthcare. I mean, I can say I loved being a nurse before COVID. I loved being a nurse before I kind of learned how hospitals are run like businesses and patients are really numbers, and it's just about turning over another bed. And so, yeah, all of that kind of killed nursing for me, and I'm one of many. I am not the exception. I would say I'm more the rule. I'm concerned that we are losing the nurses that want to actually continue their career in nursing. You know, on the one hand, everybody clapped for us and made banners and nurses are heroes. But on the other hand, we were being put into working situations and working environments where we were not provided with the basic needs to protect ourselves. And so everyone's cheering us on. It's like, you know, I actually didn't sign up to do that. I did not think of that when I became a nurse. I didn't want to be a martyr. I didn't want to be a martyr for my patients. Does not make me a bad nurse. It's just the truth. You know, I want to protect my patients. I want to do right by my patients, but I want to protect myself too. I want to protect my children too. So because of this, regardless of what the CDC says or what the AHA says now, I will continue to put myself first because, one, I have children that depend on me, and two, I can be a nurse or a nurse practitioner to no one if I am not well. We really need to be taking better care of our caregivers if they can continue to take care of anybody. It's really kind of common sense. When we had our first wave of COVID, as many of you probably know, I was working as a nurse in a very hard-hit emergency department, and I can tell you firsthand, the experience was extremely frustrating. On one end, I really wanted to do my job and I really wanted to help people, but PPE was scarce. It was reused, it was returned, it was hoarded. Again, these are basic measures to protect myself, and that doesn't make somebody selfish to want to protect themselves. It was just a very scary time, and it was filled with a lot of unknowns. But, you know, from being told, you know, not to wear our mask 24/7 while working, for fear of inciting fear in the general population, to being told that bandanas should suffice for face coverings, to being told we need full PPE garb. I mean, I was wearing, a lot of stuff was donated to us at this time because Lord knows we were not prepared for this. But I think it was GM, it was one of the big car manufacturers. They were taking their airbags and repurposing them and making them making gowns for us. So I had this ginormous gown on, an N95, a mask over that, a face shield, a cap on my head, gloves, you know, all of this, to then being told, you know what? The 195 is fine. Just reuse that for 3-4 weeks until we happen to scrounge up some others. And then they took our N95s and they cleaned them for us and returned them in brown paper bags. I mean, all of this was real life, and this is because clearly we were not prepared for the pandemic. Even though we know history repeats itself and we know that a pandemic was due to occur, hopefully we will learn from this and things will be different next time, but I doubt it. I want to say I have faith, but I don't. It would be a lie. And now, surprise, the newest gift from the CDC is actually you can go to work while you're sick. So I think it's pretty easy to see why healthcare personnel would feel like lab rats in this pandemic. Now we are almost 2 years into this pandemic. I cannot believe it. And nurses and other healthcare personnel are still being exploited. The CDC's definition of crisis care is an extension of a disaster response. Just like the focus of a mass casualty, how can we do the greatest good for the greatest number of people? That is the situation that we are in right now. How can we? How can we do the greatest good for the greatest number of people? Well, unfortunately, with the situation that we are in, this means sacrificing the mental, physical, and emotional well-being of healthcare personnel. I think it's safe to say that the CDC and hospital administrators are willing to make the sacrifice. So what is the answer? Is there an answer? I really don't think there is. I don't think there's going to be a perfect answer. Somehow, some way, somebody is going to be upset. Somebody is going to get hurt. There's just no way around it. We're in a really crappy situation. The reality is that we are in a pandemic. There are a lot of people really sick, and we are losing staff. That is our reality. And so we do need to have a plan in place for these crisis situations. So I guess my point being is that we can't avoid it. But what we can do is increase the incentive. I think for starters, if we had less people in the place of power or making these new policy changes that have no actual real world connection to working frontline in the pandemic, we need less of that. We need more people in power making policy changes that are actually relevant to what's going on. And I think until that happens, we are going to continue to have a lot of really disgruntled nurses. Just one quick example, I thought it was really funny. In the article, it says, we're the healthcare personnel that are testing positive. Those ones that are going back to work, well, here, we just won't have them take care of the immunocompromised. Instead, maybe they could take care of only those who are also already SARS-CoV-2 infected. It's like, oh, that's real pretty in theory, but have you ever worked in the ER? Because you would know that there's no real way to divide up all the patients coming in between immunocompromised and compromised. We just don't know in the ER. Anything and everything can come through the door. So for you to even say, well, here, only those who are infected with COVID, they can take care of non-immunocompromised patients, clearly you haven't worked in the emergency room. That's not how it works. So again, that's just one example, I think, of where if you had somebody in power making these policy changes, they'd be like, oh, wait, no. That's not realistic. Secondly, which I already hinted at, is we really need to up the incentive for people to want to stay in this field. The incentive is not there right now. And just to give you an idea, so when I was working as a nurse during that first phase, I was paid just over $30 an hour working as a nurse in the department. When COVID hit, they eventually started offering critical staffing pay. And so that was $15 an hour extra. There were stipulations, however. So first, you had to work a minimum of 24 hours a week at whatever your base pay was. So I would, 30 and some change. I would have to work 24 hours. And then I would be eligible for the critical staffing pay if they offered it. They didn't always offer it. It was dependent on if they were having extremely high influx of patients and really short staff. And they were basically desperate for staff to come in. And so they offered this critical staffing pay. It's always temporary. It's always a temporary quick fix, hoping not to pay out long term. Same thing with the travel nurses. You cannot blame anyone for leaving their regular nursing jobs to a travel nursing job because they're making 3 times more. So there's incentive. There's incentive to leave your regular nursing job and go on to travel. Where is the incentive for these nurses to stay in their home base and continue to ride out the storm at their hospitals? There's really not much. And so anyone that does stay, kudos to you. It just seems like hospital administrators and those in power are always looking for ways to cut corners and save a few bucks, as long as it doesn't mean it's coming out of their checkbook. If you hear what I was just making, it's decent income, but it is not for the job that I was doing. When I can find that outside of the hospital and I'm not taking care of extremely sick, full care patients. I mean, this is total care patients. In the ER, we would often get ICU holds, plus all of the ER influx. ER, you can't turn patients away. So the job that I was doing and the pay did not equate, especially when you remember CEOs are multi-millionaires. These people aren't saving grandma. The nurses are saving your grandma, not the CEOs. I believe that nurses truly are the backbone of healthcare, and if we continue at the rate we are going, I really do worry about the future of our healthcare system. I am still in touch with a lot of nurses that work in the ER that I used to, and just the other day, they passed a 30-hour wait in their waiting room. To me, that's really scary, because it's not that we don't have the know-how and the tools to save people and help people and give them back quality of life and years with their family. We don't have the staff to take care of and do said job. So there are people sitting in the waiting room. There will be people that will die waiting for care that they cannot get because of how short-staffed hospitals are becoming. So I think that's going to be it for today. It was a little different. I kind of went on some tangents and shared a lot of opinions with you, but this is real life right now, and I think it's really important to talk about and discuss. It's not that I don't understand that changes need to be made, and hopefully we're moving into a direction where this new variant, it just kind of turns into the common cold and we go back to work and maybe see some glimpse of normalcy. We also have to be real and realize that we are asking a lot of our healthcare staff and our healthcare personnel, specifically those working within the hospital systems. And so we really need to up the incentive. or our healthcare is just going to continue to crash and burn. It's already on its way. So something needs to change. And we are definitely seeing the overflow in the outpatient setting. The last 2 days that I worked, I have seen 80 patients. 80 patients in 2 days. Significant amount of them were COVID positive also. And it's just the way that things are going, it's not looking good. I'm hoping that things turn around. Definitely did not know there would be a pandemic when I got into nursing, and I don't regret it. I found a new way to love nursing. I don't want to leave this on the idea that I don't love nursing still. I did not love what I was doing at that time working in the hospital. And it's sad because in the beginning I loved my job. I loved working in the ER as a nurse, but that definitely changed, and I know I'm not alone. Luckily, I found a new path and a new way to love nursing again. Hopefully, if you are in a situation similar to what I was describing, I hope that people will begin to realize your worth. And if not, I hope you muster the strength to leave, because at the end of the day, I don't give a crap what the AHA or the CDC says. I think that you should put the mask on yourself first. But all right, guys. I wish you all the best. Don't forget to learn something new every day. Don't forget to subscribe to the channel. I really appreciate all the support. It helps me to continue making videos like this one or like my educational ones. It just helps me to continue this platform. I always appreciate your support. And until next time, I wish you nothing but the best, and I'll talk to you soon.